overtreatment versus undertreatment in the management of cancer. Hi there, my name is Dr. Walter Lemo, naturopathic physician who has a practice solely focused in cancer care for over 20 years. Recently, I was with a patient who had a history or has a history of breast cancer post-surgery, and we were reviewing her pathology report. And while on the whole it looked to be lower risk, favorable, like say, so it's hormone positive, HER2 negative breast cancer, but yet there was one little detail that could suggest some high risk potential. And so the discussion then began regarding how the system is designed in the management of cancers. So generally speaking, if there's sometimes questions or doubt, there's error on, well, let's provide the treatment, just in case. So for example, say chemotherapy, and because you never know, like for that person, maybe down the road, there's also potential legal issues as well. And so for example, when I started practice, for the most part, most women with breast cancer were actually given chemotherapy like after surgery as a potential mop-up. And knowing that, here they're giving it to a larger group of people just to try to benefit a smaller group of people. And obviously the challenge historically been is how do you pick them out? So then move forward to the future, there's these kind of genomic tests that became popular and validated. So for example, the oncotype test or the mammoprint test is another one where they could actually pick out this group that could be, better responders to treatment. And so again, the general public just needs to be reminded that specialists are in this position where it's like they're trying to do what's best for the patient. There's potential like legal ramifications as well if something happens down the road as well, and so they will err on more treatment, even though say more may not work for that patient down the road, or it could be hurtful. It's just that's what the system is. And because we know there's treatments, groups of patients that it can be helpful for. It kind of reminds me a bit is that in the management of prostate cancer, so when I started, there was no such thing as active surveillance or active monitoring in groups of patients with prostate cancer, where everyone was treated, whether it was like a surgery, it was radiation, or even hormone treatment was an arm, and there was no actually group of just monitoring them, doing nothing. And then move forward to the future, they realize, hey, those who have lower risk features, you don't have to jump in there and treat them right away. You could just monitor them for periods of time, could be many years. But it took those years to try to have that recommendation of just stepping back and watching groups of patients. So this is how the system is designed. And it's not just with, chemotherapy, it's radiation, hormone treatment. It's the whole kind of system, how it's designed that way. Right or wrong, that's how the system is designed, on over treatment versus under treatment unless proven otherwise. Hopefully that helps to clarify things.